You walked in here with an allergy, and I watched you.
Yes.
And you could have taken an antihistamine.
Absolutely.
It would have taken some time to work.
Yes.
But the homeopathic remedy in your histamine complex worked straight away.
There we go. You saw I was sneezing and my eyes, I wanted to start rubbing them. Yeah, 2 doses in 10-minute interval.
Wonderful.
And I'm fine now.
Wonderful.
Yeah, true.
I'm here in the Western Cape, South Africa, with pharmacist Ian Wheeler. We're going to talk about his range, Pegasus. It's a homeopathic kit for the home, an absolute must-have. I've raised 3 children on the homeopathic kit, Pegasus, and welcome, Ian.
Thank you, Daleen.
What a lovely combination to be a pharmacist and dispense homeopathic products.
Yeah, I qualified as a pharmacist many years ago, but was always intuitively drawn to natural medicine.
Mm-hmm.
And so I did a lot of reading and eventually started expanding the pharmacy into a health shop, inclusive, and eventually did 3 years of classical homeopathy with a world-renowned homeopath, Ruth Bloch. And she gave us a great privilege, her life's work in 3 years, to doctors and pharmacists that were interested. And I decided it's a wonderful healing modality, and my colleagues 16 years ago needed to know about it. And remember, those old pharmacists were quite skeptical.
Yes.
And so I created what I call a clinical range of remedies for ease of use for the layperson and the professionals alike.
Right.
And this is my passion. I can now fully focus on it.
Usually when someone says this is their passion, often it's because of something that happened in their life, either a sick child or some other reason why homeopathy triggered this interest.
Okay, that's interesting. As I said, intuitively, because as a pharmacist, you're acutely aware of the side effect profile of all drugs. So as a pharmacist, I'm saying to you, they can be life-saving, but you want to limit the use and the time period that you use a chemical. Because the longer you use it, the worse the side effect profile. And when I decided to create a range of clinical remedies, not single remedies, that's classical homeopathy.
So this is complex.
This is complexes, but unlike very dangerous to throw a bunch of drugs together. Polypharmacy is very dangerous. Sure. So people might say, oh, it's a shotgun thing. It doesn't work like that with homeopathy. If you take my sinus remedy, Craig does, I do, each individually, you will pull out of the 8 or 9 remedies that which is pertinent to that individual.
Right.
So it works still in a classical sense. Okay.
So a homeopath would give you a single remedy normally,
Yes.
but they might be wrong.
Well, a qualified homeopath will get it right 97% of the time, but it can take time,
So this is a mom treating her children. She doesn't have time.
Exactly.
And she doesn't want to get a drug straight away,
Right.
go for the big guns.
Yeah.
So she uses a remedy that her ideal remedy may be in there. And I mean,
Exactly.
I've had so many nights
Yes.
getting up and running to the Pegasus kit
Right.
to find a remedy,
Right.
because you can't get your homeopath in the middle of the night.
No, quite. So as a pharmacist over the years, it's wonderful as a complementary medicine. It's not one or the other. I use this hand in hand with my allopathic drugs, often where it's applicable to wean a patient off of a chemical drug.
Right.
So your people abusing painkillers, sinus medication, it goes on and on. You can now introduce the homeopathic remedy in conjunction, but say 3 to 5 days, and they can wean themselves off of the chemical drug.
Right.
Homeopathy at this level, we work with quite high potency, which translates into quite a rapid response to the symptom. And most important, as a pharmacist, it's treating the cause, not just the symptom.
Right, so important.
You
So
see,
important that.
yeah.
And with the pharmacist's mind,
Yes.
you train to dispense.
Right.
Was that the reason why you made a kit? Because it's just so much easier than doing a script on demand and doing a
Right.
complex remedy on demand, behind the counter for a mom with a sick child or elderly. It really works for everyone.
Yeah. Okay, so the whole idea, number one, treating cause and symptom. So my own boys, for example, are 25 and 28. They've had one antibiotic in their lives.
Wow.
And on both occasions, they were away from me. So the idea of this was to support the homeopaths, to promote homeopathy. We're not in competition with the homeopaths. Very few pharmacies have the knowledge to dispense this kind of medication. So it was to create an environment for a mom, to peace of mind, to have this little blue box which can treat 100 different conditions safely. Does that answer your question?
So 28 remedies that you created to treat over 100 conditions.
Yeah.
But the point is, you had the idea to make this kit because of feet through the door and the most common ailments, which in turn then helped a pharmacist to dispense, because there it is, it's done.
But in a first trimester pregnant mom, very few drugs you can or want to give while she's breastfeeding the newborn infant. All instances where this is brilliantly safe, and the pharmacist's back is up against the wall. They don't know what to do. And the average patient, they walk into a pharmacy, they've come for a solution. True. So you can't say, well, ma'am, you're pregnant, you know what, go home, suck a vitamin C and hope for the best. They can now treat the condition very successfully without any harm. Chronically medicated patients, they're on serious drugs chronically. A lot of the over-the-counter drugs are contraindicated. So hypertensive patients, epileptic patients, asthmatic patients, you're very limited with your over-the-counter drugs. Whereas these fit that profile, they do the job.
It's very handy, and I do have to ask you, this little bottle doesn't last long. So the solution?
Well, there's 50 doses in there. So that's a 10-gram bottle of little sucrose pillules, not fructose, not lactose, but sucrose, because a lot of children are lactose intolerant. But 50 doses, that's enough for 2 or 3 episodes. Should it finish, the patient then goes back to their pharmacy, their health shop, buy the bigger one, which is 150 doses. Right. They retail at about 130 Rand. Right. It's less than R1 a dose. Now, you try and buy a drug in a pharmacy less than R1 a dose.
Thank you, Ian.
Not going to happen, eh?
Thank you. So you can just fill it up from the big container, and you can actually take it and put it in your car.
So I travel with the kit in my car. I've had it in the car for many, many years and refilled it a number of times. So once you bought the kit, it's ready forever. It's a once-off purchase.
And it doesn't go off in the car.
And they don't expire. By law, we must put an expiry date on for the registrations, but it does. As long as it's kept sealed, away from moisture and strong aromatic smells, the homeopathic, it's energetic medicine. It doesn't expire.
Okay, he said energetic medicine, which is a clue for me to invite you back.
All right.
Can I have you back one day and we just talk about homeopathy?
I mean, I haven't put you off yet, did you?
No, you never will. I'm such a fan.
Good, absolutely.
That's lovely having you.
Thank you.
Thanks.